how can you manage ADHD in children with autism?
ADHD is a big problem. In fact, autism and ADHD, they almost go hand in hand. As many as 60 to 70% of patients with autism has ADHD. There was a time that we could not give two diagnoses for a patient. Autism was autism, you could not add ADHD, but the whole thing changed, and now we can give dual diagnoses, ADHD, autism and ADHD. Their ADHD has to be managed. And therefore, when I combine ADHD medications, they do much better. The medications are very standard, and that is, the most of them will respond to stimulant. And the stimulant are two kinds. One is methylphenidate, Focalin, the Ritalin, Concerta, all those medications can be used. If they don't respond to that, then they can go on amphetamine medications like Adderall or Vyvanse. And if they don't do well on stimulant, then I put them on non-stimulant medication. And some of them could be Coolbree or guanfacine and so on. So the medication therapy is very standard for neurologists or child psychiatrists like Bob with so much of experience. It's very, very simple. Okay. Now, this is what I have seen. You see that Exit Autism book. And my recipe is, if they have autism, if they have ADHD, and many of them have social issues, the thing that I have seen work is put them on, of course, all the therapies. Education is very important. So find a teacher who can really work with child. Put them on ADHD medication, because that improves their cognitive functions, and they will learn or they will respond to therapy much better. And add some SSRIs, either Prozac or Zoloft, whichever, it doesn't matter which you choose, because that will improve social interaction. And that way you can see behavior gets better, their academics get better, they learn because they understand much better, and their social area goes well. And most of the patients, and I'm talking about severe patient, normal patient, I mean, mild level 1, anyone can improve them. That's not a big deal. The big deal is when you have level 3 severe patient and improve them now that they can have a job and they can one day have a family. That is a skill. And that is what I have seen. Therapy, very important. Academic, very important. I insist that you get a teacher to teach them how to read well, how to write well. And that is extremely important. That is many times missed because they go on ABA therapy for such a long time. And that takes time away from academic. Academic is extremely important. Therapies are important. Social skill classes are important. But medications are very important because you can make a change. And ADHD medication is part of it.